infection of the central nervous system. Counterintuitively, viral is much less severe, thankfully much more common than bacterial. Rationale being, a comment, is that bacteria can be helped by antibiotics, whereas viruses cannot. So one would think, like I asked you, which one would you rather get? And most people said bacterial, which is logical, completely logical, and that's what every class says. But it is, bacterial has an adult mortality rate of up to 10%. Viral meningitis is mostly a disease of childhood, and virtually all people recover 100% with just supportive care, which just means hydration, bed rest, symptom control, and they ride it out. So I told you that I missed a viral meningitis in a patient, and you know, I don't accept any failure on my part. So I was very hard on myself about that, although the argument could be made. He had been coming to see me off and on for years for neck pain and headaches. So as I told you, he showed up one day with neck pain and headaches, as usual, neck pain and headaches. The only difference was his neck was particularly stiff. His range of motion was particularly limited, which I consciously noticed, and he felt slightly warm. Not burning up, but you know, it's Florida, right? And it's summertime, it's August or whatever, but it was summertime. And I thought, well, you know, but anyway, you know what they say about assuming? So I didn't see him for a few months, which wasn't really unusual for him. I'd treat him once or twice and he'd be fine. And he was on a PRN basis. Does anybody know what PRN means?
As needed?
As needed. What is the actual abbreviation? What is the Latin meaning? PRN, pro re nata. You'll see that a lot, and it means as the need arises, loosely translated. But anyway, he was on a PRN basis with me, so I didn't see him for, I don't know, a few months, I forget how many. And when he came in, he said, hey man, last time I saw you, my neck got so bad, and I spiked a fever, and my headache got so bad, I had to go to the emergency room. This is he was an athletic man. And of course, tell me more about that. And he said, I ended up with viral meningitis. So, but he recovered fully, no sequelae, and you know, he didn't blame me. You know, it would have been missed by most people, but you know, we don't allow ourselves to think that way. We think we want 100% perfection. But that was one I missed, and thank God it wasn't bacterial meningitis, because the story might have been a lot different. So anyway. So there are the idea with meningitis, meninges, as you know, the dura, they are the coverings of the cord, 3 of them. They become infected, and there's encephalitis and meningitis, and there's meningoencephalitis. But what happens is the provocative testing for meningitis is to stretch the meninges. And they are so angry when they are infected and inflamed, they do not like that. So the typical response is avoidance. And the 2 primary orthopedic tests that we will do are Brudzinski's test or sign and Koenig's test or sign. As you know, a test is positive or negative, and a sign is present or absent. So we're learning to speak the language. You know this already, correct? Good. I just like to double check, because sometimes I'll spend a little more time on things if you're not fully aware of these things. So anyway, Brudzinski's test is so simple that I'm not going to have us do it, because we're going to do another test called the Soto-Hall test today that is exactly the same, except the arms are crossed across the chest. So Brudzinski's test and Koenig's test are for what's called meningismus, testing for meningitis. Meningismus is nothing more than another word for meningeal irritation due to meningitis. It's just a different word, and I like to give you alternative terms because it's commonly used, and it may be how you encounter it. So I don't want it to throw you off. I know what meningitis is, but what on earth is meningismus? It's essentially the clinical presentation of a patient with meningitis, signs of meningeal irritation. So with Brudzinski's test, or the Brudzinski sign, you may see it as test or sign. The patient it's a completely passive test. It's a weird name. So it's not like the straight leg raise test, which is kind of sort of self-explanatory. So Brudzinski's test is a passive test. Both Brudzinski's and Koenig's, in fact, most of the tests you'll learn in my courses are passive. It's essentially the patient is supine, and you're going to flex the patient's neck. And in the process of doing so, you are stretching the meninges. One of the things that I saw in my patient is he had a hard time flexing his neck just actively. It's exactly the same process. But I was kind of used to that because he was always very active and doing all kinds of stuff. So he'd come in with limited range of motion, but this time he was having a hard time flexing, especially. This is called nuchal rigidity, and it's a hallmark of meningitis. Nuchal rigidity, fever, and it gets to the point where the patient's got altered consciousness if they're obtunded or talking nonsensically. They typically won't come to your office, although I wrote a case report about one of my patients that had a carotid dissection, and fortunately we did not miss that. But she was talking nonsensically. Similar presentation. She was a headache patient that I'd seen. 48-year-old teacher. Anyway, so we're looking at nuchal rigidity, we're looking at a fever, we're looking at a patient with a headache, and those are typically patients, that's how they'll present to you. That is how he presented to me. I'm sure if I had my one of my staff members get his temp, it would have been at least slightly elevated. Like I said, he wasn't burning up to the touch, but he was warm. So this is what happens. You start in this position, then you elevate, you passively flex the neck, and what will happen is when you stretch those meninges, the hips and knees will flex because the patient is attempting to take stress off those meninges. It is involuntary. They may even keep you, when you start to lift their head, they may go, ow, ow, ow. They may not be able to do that, depending on the severity of their meningitis, of their meningismus. So that is a very simple test. The key, the positive sign, is the hip and knees flexing. This came right out of Evans. That is Dr. Evans, as some of you that were at the presentation know. He says flexion of both knees and sometimes both hips. Well, you can't really flex your knees without flexing your hips. But I left it in there out of respect to my pal. So anyway, that's Brudzinski's. Now let's talk about Koenig, and I have a mnemonic for you to help you to differentiate. You're out of luck with Brudzinski's. I have been trying to figure out a mnemonic, and I just haven't done it. But Koenig, with Brudzinski's, you lift the head. With Koenig, the patient is supine, and we'll go ahead and practice this. Of course, this is also very similar to the Lesage test that you'll learn in lumbar spine, but we might as well do this. Are we comfortable with hands-on here? I mean, I know we've dealt with COVID and all that jazz, but anyway, we really do need to do, I'm a hands-on kind of guy, so you learn by doing, right? Watch one, do one, teach one. That's the medical model. So we're going to do one. Koenig is where you lift, it's passive, you flex the hip to 90 and the knee to 90. Then you attempt to extend the leg at the knee. Remember, this is the thigh and this is the leg in proper anatomical terminology. So we're going to attempt to extend the knee or the leg at the knee. And one of two things will happen if a patient has a positive Kernig's or the Kernig sign is present. They will either resist that forcefully because you are further stretching those meninges, right? Or they'll attempt to mitigate it by slowing down the process in their other leg. They'll do exactly as they do with the Brudzinski sign. They'll attempt to mitigate the stretch on those meninges by flexing the other hip and knee. So how do I differentiate? My mnemonic is Kernig starts with a K, kick starts with a K. It's like they're attempting to kick. You're trying to make them kick. Works for me. Feel free to use it or not. So this is what happens. You try to straighten that leg out, but again, that is not going well when you pull on those really, really bad meninges. And the other leg will do exactly this. If it's a severe case, they won't even let you get to that point. They will go, nothing doing. So let's just kind of start our class by doing the Kernig sign or test. We're going to flex the knee and the hip to 90, and then the other leg is flat. It's completely passive. And then we're going to attempt to slowly extend the leg at the